At the YMCA of Central Ohio, we believe in both individual and group goals and supporting our children to discover who they are and what they can achieve. At the forefront of this commitment is to do so safely with the best interests of the children in mind.
Nationwide Children's is proud to partner with the YMCA of Central Ohio to reinforce the importance of proper nutrition, conditioning schedules, and guidelines to keep our young athletes safe. Please take a moment to enjoy this video and this important information.
Go.
An overuse injury is an injury that's sustained when there is not a specific time of injury.
Somebody is using a body part at a more intense level, which is ultimately required for training, but going beyond what the tissue is prepared to take and not giving that tissue adequate time to recover.
Overuse injuries are very common, and they're increasing in number and severity as children are participating in more sports.
For the most part, swimming injuries are almost always going to be overuse injuries.
Kids try to do too much too fast, so your body's not used to that stress, and the tissues start to break down at some point. Another way that happens is improper technique. So if a person isn't doing their sport properly, if they're using bad mechanics, then that puts more stress through their joints and their muscles and their ligaments than it needs to. With swimmers, we know that most of the power comes to the shoulders, and swimmers tend to pull with their arms really hard on most of their strokes. And the shoulder muscles are relatively small in comparison to the leg muscles, for instance, and they get fatigued very easily. So the mechanics tend to break down faster, the muscle tends to get tired faster, and it takes longer for them to recover. If you have an athlete or a swimmer with a shoulder that's sore for a couple of days, that's something that needs to be addressed sooner rather than later.
If a patient is starting to have limitations in their practice or in activities of daily living, that child is doing things differently, limping, can't mow the lawn because their shoulder hurts, these are definite signs that patient should be seen by somebody with knowledge about these kind of injuries.
Number one, we know it takes you less time to recover. Number two, it's easier to fix some of the mechanical flaws that might exist in their stroke sooner rather than later. And number three, it prevents time away from your sport.
Overuse injuries are always easier to take care of in terms of prevention than in treatment. In terms of treatment, the types of time frames we're talking about are 6 weeks, 6 months, sometimes even beyond. They can actually be career threatening. You
shouldn't increase your workouts more than 10% every week. So if you're swimming 5,000 yards a practice, then you shouldn't swim more than 5,500 at all the next week. Kids should at least have 1 day off per week where they're not doing any organized physical activity, and at least 2 months off per year. That's actually a little bit more for kids that participate in sports that use the same body part. So if you have a swimmer and a volleyball player that are both shoulder intensive sports, they're probably going to need more time than that off. Having appropriate coaches teach the proper mechanics will definitely help prevent overuse injuries as well.
Parents need to recognize that if their child in their sport is complaining about a certain body part day after day, they need to attend to that. If we can prevent the overuse injuries, their child will be able to continue in their sport and do so without getting an overuse injury.